بسم الله الرحمن الرحيم. أنا معاكم الدكتور حاتم أمين خطاب، استشاري أول طب وجراحة العين بكلية طب جامعة الزقازيق. ده جزء من البرزنتيشنز اللي احنا بنقولها دايما، اللي احنا بنسميها الانجوي اوفثالمولوجي أو تمتع بطب وجراحة العين. حديثنا النهاردة عن اللي احنا بنسميه الريد ريفلكس أو الانعكاس الأحمر. إيه تعريفه؟ Red reflex is the reflected image of the illuminated area of the fundus formed by the patient's own refractive media. هو انعكاس لإيه؟ هنقول دلوقتي. Normally the pupil is black since no light is coming out from inside the eye. Like this dark house, we can't see any detail because no light is coming out from this house. Unlike this one, you can see the details of this house because it is lighted. Light is coming out from the windows and doors. When light is shined into the eye, it is reflected off the red-orange choroid, and the reflected light produces a red-orange or sometimes orange-yellow light called red reflex. This is the first layer to stop light from passing through clear media. On tracing light journey through the human eye, the start is at the tear film, then the cornea. The final destination is at the choroid. The choroid is an opaque layer full of blood vessels. عشان كده لما اللايت بيسترايك the choroid بيرجع لك بدرجة من درجات الرد. This is the normal red reflex. This is the normal red reflex. When the red reflex is perfect, this means all the media are transparent and the retina is in place. Different methods exist to detect the red reflex. The direct ophthalmoscope, the indirect one, the slit lamp, the retinoscope, the reflecting mirror, as well as the operating microscope. Concerning the abnormal red reflex, this depends upon the medium that obstructs light on passing through the eye. The red reflex gets yellow if pus obstructs light, like what occurs in endophthalmitis, which is an intraocular inflammation principally involving the vitreous body, and in panophthalmitis, which means intraocular inflammation affecting all the three ocular coats. It gets a black color in massive hyphemas and massive vitreous hemorrhage. Reflex gets gray in retinal detachment.
This video shows a large bullous retinal detachment as viewed through a contact lens. Now this is normal retina up here, and this down here is the bullous detachment. This is all detached retina down here. If we look down towards the bottom, this is actually a superior retina. You can find the hole. It's kind of hard to see, but this is it right here. And there's sort of a corrugated appearance of the retina over here, which is classic for rhegmatogenous detachments. Through a 3 mirror, you can see this hole perhaps a little bit clearer. It's quite obvious here. Now, on an ultrasound, what we got here is how this looks. Back here is the optic nerve where the retina is attached, and up here is the oris serrata. And as the eye looks up and down, you can see this retina moving. And if you look at the A scan, you can see it spiking and corresponding to this retina.
The previous video, the red reflex is gray in the lower part corresponding to the detached retina. The red reflex becomes white in certain conditions collectively called leukocoria. Leuco means white and coria means pupil. Exactly like the glow of cat's eyes. These are examples of leukocoria. We have a big differential diagnosis for leukocoria. Other examples of leukocoria or white pupil reflex. Leukocoria or white pupil reflex. Other examples of leukocoria. Retroillumination means that light is reflected off the iris or the fundus when the microscope is focused on the cornea. This technique is used to observe media clarities and opacities. The pupil is dilated and the slit beam and microscope are made coaxial. The light is directed so that it strikes the fundus and creates a glow behind the opacity in the media. The media opacity creates a shadow in the glow. The microscope is then focused on the pathology directly and with 10 to 16 magnification is used. This is an example of retroillumination from the fundus. We use retroillumination to observe structures through light striking the fundus. The red reflex is visualized and photographed through retroillumination. We have miscellaneous applications of the red reflex. This is an example of the typical reflex in typical cortical cataract. Black triangles against red background. Other examples of typical cortical cataract in different grades of maturity. And this is an example of the typical cortical cataract. And on the right side, this is photographed through retroillumination. We notice black triangles against red background. On the left side, we notice grayish-white opacities and oblique illumination. This is the appearance of the red reflex in cases of nuclear cataract. The appearance of the red reflex in congenital nuclear cataract. This is the appearance of the red reflex on photography of zonular or lamellar cataract. Other examples of zonular or lamellar cataract, disc-shaped opacity with terminal extensions like the riders of a steering wheel. Appearance of red reflex against sutural cataract. Red reflex in coronary cataract, it's called coronary, like the coronary arteries around the heart. Red reflex in traumatic rosette-shaped cataract. Red reflex in posterior subcapsular cataract. Red reflex is also greatly used in ophthalmic surgery. It facilitates anterior capsulotomy. It facilitates irrigation, aspiration of the cortical material. Also, it facilitates intraocular lens insertion inside the capsular bag. The eye oil is inserted in the capsular bag, which is the space between the posterior capsule and the edge of the anterior capsule to be well centered and away from the sensitive uveal tissue. We have many applications also, like assessment of the refractive status through the retinoscopy reflexes. On retinoscopy, we may get against movement, with movement, or no movement at all at the neutral point. Also, on observing the retinoscopy reflexes, we may notice some important reflexes like the scissoring reflex of keratoconus. For contact, this is my WhatsApp number. This is the Facebook page, and this is the YouTube channel. This is the appearance of the YouTube channel. My team, I hope it has been helpful for you, and thank you.